Hi everyone, I'm Stephen and I'm responsible for marketing at TRL. Welcome to the first in a new series of webinars that we're going to be hosting with leading trade publication Highway News. If you don't follow Highway News, make sure you visit their website at highways-news.com and sign up to their newsletter. It's full of daily insights, action-packed, is really worth a read. For those not familiar with TRL, we're a UK-based innovation and research social enterprise. The mission is to create clean and efficient transport that is safe and reliable and accessible for everyone. TRL has an extensive range of services, products and expertise focused on improving road safety that is in use across the UK, Europe and parts of developing nations across the globe. We've got quite an extensive range of safety products, from our IMAP collision data software to the work we do with DFT on the RAIDS database, to our collision teams, to the safe system strategies for local and national authorities, to our expert witness teams. Across all these areas of TRL expertise, there is one main reason these products and services are needed, and that's the common thread that people speed and speeding kills. We've therefore brought together this panel of leading industry and TRL experts to discuss the attitudes towards speed, what this means for road safety, and how we can try to change attitudes. Today's webinar runs for about an hour, so we've got plenty of time for questions, so please do use the Q&A function. We will be recording this as well. I'll now hand you over to our host, who will also introduce the panelist, Paul Hutton, editor of Highway News. Over to you, Paul.
Thanks very much, Stephen, and thank you for joining us on this webinar. And if you're in the USA, thank you for joining us on Thanksgiving. I'm sure you'll make up for your early start with plenty of turkey and NFL later. So let me first of all introduce you to our panelists. So please welcome along some real expertise for you for the next hour. Dr. Nick Reed is founder of Reed Mobility, and he's also the chief road safety advisor for National Highways. Dr. Phil Hyde is a paediatric intensive care consultant at University Hospital Southampton NHS Trust. Dr. Shaun Helman is chief scientist at TRL. Dr. Phil Martin is head of transport safety at TRL, while Nancy Abira is a safety consultant also at TRL. So we have, as I say, real expertise in the next hour, and I think our challenge will be to keep everything into that amount of time. But I'd like to start with you, if I may, please, Shaun. And I want to start with a view of speeding as far as the driving public is concerned, and I've been particularly interested with the reaction to the 20-mile-an-hour limit in Wales. How would you describe the response to that and the attitude that we see when it comes to speeding?
Good question. The response to things like speed limit changes in the media that we see are often very different to the responses we see in the public. So, for example, we know from national attitude surveys that when you ask people the kinds of things they're worried about in their local area, it tends to be speeding vehicles that are at or near the top of that list. But it's a complex thing. Public attitudes towards speeding and speed limits are complex because we know, for example, that people have different attitudes about when it's them that's doing the speeding versus when it's other people, speeding in their particular area. So there's a number of things to be thinking about here. I mean, one interesting thing I think is that if you look at free flow speeds over the last decade or so these are the sort of speeds measured by the DFT using measures on the roads and crucially when traffic is free moving, not just when it's nose to tail traffic jams. We see over time a steady decline in the proportion of vehicles speeding in 30-mile-an-hour areas. Now, it might be a bit different on motorways and faster roads, but I think that's interesting. And in fact, I think this year or last year, it reached 50% for the first time. So we are getting to a point nearly when the majority of traffic will not be speeding in 30-mile-an-hour areas. Now, 20-mile-an-hour limits, different thing altogether. We'll probably talk about that today. But yeah, it's a complex picture. Generally, I think people understand the needs for speed limits.
Okay, thank you. So Nick mentioned there about potentially difference on motorways and the major roads on the strategic road network. You're the advisor to National Highways. What have you found?
Thanks, Paul. Well, yeah, so yeah, National Highways is the road authority responsible for the strategic road network. The motorways, the main roads in England. And in 2015, National Highways set a zero harm goal, that no one would be hurt when using or encountering the strategic road network. And the way to achieve that, the strategy that was adopted, was the safe system approach. So the safe system approach recognizes death and serious injury is unacceptable, but people do make mistakes, and that those mistakes lead to crashes. But when those crashes happen, they should be of a severity that prevents death or serious injury. But you need to adopt a systems approach to achieve that, because if one element of the system fails, you need other parts to enable that collision to be of the lower severity. So one of the pillars of the safe system is safe speed. And the safe speeds pillar recognizes that the particular combination of vehicle, environment, infrastructure, and drivability should be such that the speed adopted prevents that death and serious injury. And I wanted to make the point as well that National Highways is a service provider, right? And so it's really important for National Highways to offer a time-efficient road network. And by that, I mean, it would be an error for National Highways to introduce measures that resulted in people choosing to use other roads, which are higher risk. Your local roads are higher risk roads than the major roads, in the interests of general lower speed. Or we need to make this network as safe as possible, but that can't be displacing traffic onto higher risk roads. So in terms of attitudes to speed limits, I think it's really important to recognise those attitudes aren't set in stone. I think that's already happening in Wales, starting to see people softening towards the introduction of the 20-mile-per-hour speed limits. Even if you look back at the introduction of the motorway speed limit, you can see some great videos of drivers complaining about that they dawdle along at 70 miles per hour. And even though cars are so much safer these days, the human limitations that are in place that mean we need to have those limits are still very much there. And those attitudes, I think, are one of the factors in those changing attitudes have been in the introduction of average speed cameras, particularly at roadworks, where people recognise, although you've got this lower speed in place, the traffic keeps moving. And although they may reach their destination slightly slower than they would have otherwise, the journey times are more reliable. So that imposition of a lower speed limit for an average speed section is actually really helpful to them in terms of managing their day-to-day lives. I think one of the challenges we have is around variable speed limits and making sure that the information associated with those variable speed limits is timely and accurate. Those variable speed limits might be there for safety, for traffic management, for air quality, but I recognise that it's the messaging that goes along with those variable speed limits isn't 100% perfect all of the time. So we need to make sure people get the right messaging and understand why those variable speed limits are put in place. And connectivity might help us achieve that. So as we can improve the amount of information we can broadcast to drivers and individual vehicles, we might be able to improve that understanding of why the variable speed limits are in place. But yeah, it's a moving target, and I think, as Shaun has identified, it's evolving in the right direction in terms of safety.
Okay, thank you for that. We've so many points to pick up on, and we'll try and pick up on those as we go along. But you'll be pleased to know I actually ran a story today on Highways News about the welcoming of a set of average speed cameras on a stretch of the A5, which is part of your remit. And it's gone down really well with locals, even though there are very many people that have got tickets. The people who actually live in that village are extremely happy with the fact that the road through their village is so much safer. We'll come back to you in a minute, Nick. I want to now move on to Nancy to get a kind of holistic view internationally, really, because Nancy, it's, as Nick said, we can't just slow everything down to 10 miles an hour because you're providing a service on the roads or getting people from A to B efficiently. So where is that tricky balance. How do you find that tricky balance between safety and mobility? And how do we determine what a safe speed limit is? And is it different in different countries?
Just to pick up, I think what first Rick and Shaun has said, especially about attitudes. I think one thing about, you see, sometimes global South and low and middle income countries, right? We appreciate attitudes cut across globally, you see. But I think in some of the low and middle income countries, there are specific contextual issues that more or less, you see, enhance speeding as compared to the other countries. I think one of the first aspects we have to say is LMICs, there's quite a high number of pedestrians in some countries, up to about 90%, you see. But secondly, I think it's also the socioeconomic aspect that comes with driving. You see, in a country like, say, Kenya, we're still talking about only 13% of the people own cars. You see, so you see the social status that comes with car ownership more or less sets aside people who can drive, apart from the other people now who don't have access to a vehicle. You see, in some of these issues, the other aspect I think is also very critical that also Reid alludes to is the quality of the infrastructure. You see, when the quality is low, people assume, you see, the road belongs to the motorist. You see, when there's poor provision of vulnerable road users on some of these LMIC's country, then there's more propensity to speed because, you see, there's no space. So if there's no space, maybe the whole idea is they're not supposed to be here, you know. So I think tackling speeding in LMICs has to come from a very local context and a clear understanding of what is happening. And lastly, also, Rick alludes to enforcement and some of these things. And also Shaun talks about, say, for example, the 20 mph in Wales and everything else, you see. But also when enforcement is poor in some of these countries in LMICs, then it's speeding is tolerated because no one comes for you. You don't get a speeding ticket, you see, in some of these places. And actually, I have a car, I have a powerful car. At the same time, the road does not provide for VR use. And lastly, there's poor enforcement. So those are some of the specific aspects that are different and very specific to LMICs that must be tackled, aside the other aspects that cut across all other countries. Yes.
Okay, we'll come back to you as well, because I want to pick up on that as well. But I want to, we've talked sort of in theoretical terms so far, but I want to get now some human terms here, and somebody who spends his life seeing the effects of speeding and the effects of road crashes firsthand is Phil Hyde, Paediatric intensive care consultant. I mean, Phil, you must have seen devastating consequences of crashes pretty much on a daily basis. And, you know, there's an argument that some of the reduction in road fatalities is actually purely down to the brilliance of you and your counterparts across the country in the trauma units. I mean, how do you find the effect of speed has an effect? What sort of effect does that have on the seriousness of the crashes, and in fact even the lives of those people you've been able to save?
Yeah, thanks, Paul. Fundamentally is the first part, and I suppose, you know, Nick picks up on the safe systems approach, and the work I'm involved with within the NHS is the after collision components of the systems, and you're right to say that the NHS has stepped towards this really since 2012, particularly with trauma systems, and there's been great improvements in trauma care objectively in England to start with, and now across the devolved nations as well. However, speed fundamentally changes the injuries. It worsens the injuries. It worsens the death. And from my perspective, and it's really interesting listening. I've already learned quite a bit. I've been scribbling down. From my perspective, speed is forcing normal people going about their normal days to become patients. And then I meet them and my colleagues meet them. And I haven't said I also work on an air ambulance. I'm the medical lead for Dorset and Somerset Air Ambulance. So I see trauma not just with a paediatric sense, but I also see adult trauma in a pre-hospital sense. And speed we see on the street taking lives unnecessarily every day. And from a clinician's perspective, that's harrowing. From the family's perspective, it's harrowing, and from the patients, if they survive, it's pain and suffering, and then a long journey of rehabilitation to get back to economic viability, if they do. And you know from the Department for Transport data that there's in the order of 28,000 severely injured, as per their data, patients per year, and 1,500 deaths. And from my perspective, they're completely avoidable. They're a man-made disease, and they have an engineering solution, which should be medical engineering actually. And that's yeah. I've been working recently with TRL and really productively to see if we can bash our heads together and come up with some enablers for pushing forward these arguments. And when I hear the Shaun pick up on the view of the public that they recognise the need for speed restriction, it makes me wonder why we have not yet achieved the simple public health intervention of controlling speed as one part of the safe system that Nick's picked out. And I would say it's very similar to banning smoking that we have achieved in my lifetime. But I remember that pre the smoking ban in public places. Why can't it be the case that in the UK we ban speeding in public places? Why not? It's a simple public health intervention, and it goes more broadly. And I know I'm speaking quite candidly, but it goes more broadly than reducing down to 20. There is an engineering solution for controlling speeds of vehicles so they are incapable of speeding. Whatever the speed is determined, the safe speed, and Nick picked up on that as well, the safe speed that is determined for the engineering that are on that road, whatever that safe speed is, your vehicle cannot go faster than that. Why do we not apply that? And I understand it's much more complex than just saying those words. But as a clinician, picking up people, humans, and broken humans off the road for the last 2 decades, I would passionately love to change that. And for my children and for society benefit for into the future, remove this unnecessary scourge from our lives. And speed is a massive component. To come back to your question, Paul, it's a fundamental to the injuries that the NHS deals with, and we don't want to meet the patients. We want them to stay people.
Wow, powerful stuff. Thank you, Phil. Let's move on to Phil Martin, Head of Transport Safety at TRL. So you obviously work on speeds. Are there any other benefits of reducing the speeds that we drive at that go beyond reducing harm on our roads? And how could these potentially be harnessed to change attitudes?
Yeah, thank you, Paul, and good afternoon, everyone. Yeah, I think it's really important to sort of challenge the way that we communicate about speed and about the benefits of reducing speed. I mean, we've had the narrative of speed and safety now for 50, 60 years about, and where that association between speed and speeding and safety outcomes has been around for many years. And this works for some audiences, but we're still speeding. We've heard from Shaun saying 50% of drivers in urban areas and on 30-mile-an-hour roads are speeding, and we know that there's sort of similar numbers on the SRN as well. So we're still speeding. So it's really important to think about what other drivers, what other motivators, what other benefits are out there from reducing speed, to try and communicate and change the way that we communicate with the people that aren't listening to that safety message. And there's lots of benefits, such as public health benefits. We have air quality and noise. We have financial benefits, trying to reduce the financial burden on the individual driver from fuel costs and maintenance of their vehicles. We have a number of social benefits as well, increasing physical activity because of lower speeds on local roads, improving community connectedness, and increasing sort of livable streets. And there's a lot of evidence sort of underpinning each of these sort of strands, the public health, financial and social benefits as well, sort of supporting the message that reducing speeds improves air quality, reduces the cost to the driver from fuel use, improves physical activity in our local streets, and provides a better place to live for our communities. So I think there's some really important messages that we can get across around those benefits that can sort of engage with people that haven't necessarily engaged in the past with the message around speeds, lowering speeds and improving safety. It's a really great example that TRL do in terms of our EcoStars fleet recognition scheme. So this provides a star rating for fleets based upon how efficient and clean their operations are, and this for trucks, for buses, vans, taxis, that it's done. And the benefits of this scheme is that it sort of raises, evaluates and raises the sort of the environmental credibility of operators of these fleets, and that can be important for future procurement of goods and services, part of the fleets, and it can drive down the costs to the businesses as well for running their fleets. And within EcoStars, there's a big focus on fuel management, with fuel management champions, fuel efficient driving, skills development, telematics data providing feedback to drivers about how they're driving to effectively drive up the star rating of their fleet. And this is all linked to sort of improving the efficiency of the fleet and independently assessing the environmental credibility of the fleet for the future. However, what we've noticed from this scheme is that by these fleets driving more fuel efficiency, the overall safety of the fleet is also improving. So speeds are on average lower, speeding is reduced, and harsh braking and acceleration events are also reduced, which are, clearly also all associated with reductions in risk as well from the evidence, from the literature that's out there. So the message wasn't anything to do with safety. It was to do with fuel efficiency, and we're seeing safety benefits from that scheme. So yeah, it's a question back to you, Paul, and to the audience about why are we not maximizing all these opportunities that we have to talk about other benefits than just the safety. We have a fantastic community of road safety experts and that can actually harness this knowledge to get our message out there in other ways, through other channels, and pull on other levers with the public.
Okay, Phil, well, I'll tell you what, I'll remind you now that we have the Q&A function at the bottom of your screen on Zoom. Please use Q&A and not chat. I already see 6 questions that have come in that we'll come to in 15-20 minutes or so, but if you want to add your question, your comment, your thought into there, even if we can't get to all of them during this webinar, we will make sure the experts see them, and we can keep the conversation going on LinkedIn, for example, afterwards. So do put your questions in to the Q&A. Nancy, I'd like to come back to you, because I've actually just got back from a holiday in Senegal, and the place is wonderful. The people are fantastic. If I had any hair left, it would have stood on end as I drove in a coach through some of the villages, and the speed of drivers and the school children walking to school a foot away from you on the side of the road, and then somebody in a pony and trap, for example, is being overtaken. And it really did astonish me how I didn't see accidents crashes every mile or two as I drove down the road. You talked about an attitude to speeding being different in developing countries in Africa and Asia from how we see them here in the UK. What have you found for solutions for reducing traffic speeds and how you need to tailor them for the regions? And what are TRL doing about it?
Yeah, but actually, Paul, I think you asked me the right question, because what we're doing right now. So there's a project, and let me start from the back. You asked me first what TRL is doing. So there's an opportune project we're working on. It's actually just at the tail end now. We on speed management, so in low and middle income countries. So as part of that, of course, the countries were many. So we only selected 3 countries: one in Africa, one in Asia, and one in Oceania. So we are it's a comparative study of these 3 countries, trying to identify what are some of the speed issues, and then how then can speed management be mainstream here. So one of the main issues from the stakeholder workshop, so the study was more or less about a lot of stakeholder workshop, but one of the main issues that come up is how the speed limits are being set. You see, generally speed limits are being set more at the national level. Ideally, we talk about the 3 elements of setting speed limit, that you have to tie the national law with the urban environment, and at the same time you have to give authority, you see, to the local councils and local authorities then to set local speeds. But then in some of these LMICs, the speed limit is set at the national level. You see, maybe we see on motorways it will be 110. In these other areas it will be 50, or it will be 80. So it takes away the opportunities for the local area then to define what the speed limits are. You see, and we've all agreed. I mean, it's research has shown, and it's a known fact, that then how we set speed limit, we must move away from the whole traditional method of, you see, how fast do we want to go? How fast do drivers want to go? But then more or less to what Phil was talking about. You see, how much kinetic energy, you see, can a body absorb when we're involved in a crash? You see, so one of the first solutions I would say is acknowledgement that then how we set our speed limits then has to change, and primarily to what you see, what the webinar talks about, the alternative, you see. And this agreement that, you see, setting speed limits cannot be a political agenda, cannot be set at a national level as a blind, you see, as a blind that covers across. But then how much, you see, how much energy then, how tolerable can the pedestrians be? And rightly you say so, Senegal is one of the countries actually with high pedestrian, you see, how high pedestrian is as part of their transport mix. You see, if speeds are set at 100 in a place, in a country, in a region that has, say, 70% pedestrians, clearly we can see where the gap is coming from, you see. So that is the most critical thing I would say, so is acknowledgement that we need a new solution to how we set speed limits. And of course, the second one that I alluded to previously too, one of the second thing that I think it comes in is, it's not just about setting the speed limits, you see, but then it's the move from how then, what kind of space we give. You see, how does the street look like? You see, when I go, the other day I was running, I think, and then I got on a road. I didn't know the area well, so I was just jogging. Then I get somewhere and I realized it seems I'm on a motorway, you see. And initially, you know, immediately it hits you how now the speeds have changed on the road. Clearly, you see, it's not pedestrian friendly, you see. And then you move away and go to more local streets. But now imagine a situation, Paul, where everywhere you walk, then it's not pedestrian friendly. You see, the anxiety, Phil talks about the benefits of speed and everything else. But I think even another benefit of lower speed is less anxiety. You see, the fact that a traveler can make travel without being anxious. You see, if I stand by the road and I want to cross the other side, you see, I don't have to feel so anxious and beg for space. You see, please stop so then I can cross. I think those two things, setting appropriate speed limits, and lastly, having quality infrastructure that more or less, you see, aligns to the kind of traffic mix we have in that area. Yes.
Okay, that's really fascinating stuff. Thank you, Nancy. Nick, picking up on the enforcement angle on this. How you mentioned average speed cameras, are they a more effective lever to use? What other levers can we use to enforce speed limits? And Phil Hyde mentioned about automatic speed limiting. What does the future of speed limit enforcement overall look like?
Yeah, no, that's great points, Paul. There are more and more levers to pull. I wanted to make the point that it's been there since the 19th century that policing is by consent. So we need to build kind of public buy-in to the measures that we introduce. But I think as other speakers have identified, that buy-in is definitely increasing. See it with community speed watch schemes, politicians falling over themselves to try to associate themselves with community speed watch because they recognize that their constituents want to see lower speeds in their communities. And so I think that that's really positive signs. Yeah, certainly we know automatic enforcement leads to a reduction in incidents, and the average speed enforcement is an even better version of that because of the smoother flows that it generates. Don't get people braking suddenly at the camera site and then accelerating away again. So of course that's a good thing. And I wanted to recognize as well the part of enforcement that comes along with speeding is the effectiveness of the speed awareness courses. So people going on speed awareness courses are less likely to reoffend, having enjoyed the education that they get on those courses. So they're more effective than fines and penalty points for many people. On the point of automation and intelligent speed assistance, to some degree, I share Phil's frustrations. It's essentially trivial now for a vehicle to know what the speed limit is at its particular location and to manage the speed of the vehicle to prevent it going above that posted speed limit. So the excuses for not introducing such systems are becoming fewer. And ultimately, one of the comments in the Q&A I've seen as well, self-driving cars will manage that process for us, but we are some time from those being certainly commonplace on the network. When they do happen, it's likely to be on the strategic road network first. So National Highways likely to see the benefits earliest. And we certainly think it will contribute to achieving our zero harm goal. It may be some time before they comprise a significant proportion of the fleet on the network. And thinking about other areas for enforcement as well, we've seen the trials that AccuSensus have been involved with, looking at mobile phone use and seatbelt compliance using cameras. So interesting ways to understand where the risk lies on the network. And the sort of Operation Ping activity that National Highways has been involved in. So this is using sensors on the network to identify hazardous driving behaviours, and where those have been undertaken by someone who's registered their vehicle for work, so a company vehicle or fleet vehicle, National Highways can advise the operator of that vehicle of the hazardous driving behaviour and get them to help manage and improve driving behaviours in future. So not strict enforcement, but trying to encourage the right behaviours. We've identified poor behaviour and we're encouraging you to improve it. And the operators involved in the scheme have to commit to improving the behaviours of drivers who are identified as through this scheme. So yeah, lots of new approaches, behavioral approaches, encouraging the right behaviors, identifying the wrong behaviors, and then introducing the right punishments for the wrong behaviors around speed and many other facets of driving behavior.
Okay, thank you very much, Nick. Phil Martin, Head of Transport Safety at TRL. We were talking there about ISA. I'm going to wager that TRL must have been looking at this. What are people's attitudes to ISA? And if they're negative, which I presume, sadly, due to human nature, they might well be, how can we actually win them over and get them onto supporting it?
Yeah, thank you, Paul, and great to hear Nick and Phil mention ISA systems as well. Just to, I'll address your points. How effective are they, and actually what are attitudes like to ISA systems? I'll address them in turn. There's no doubt that ISA has a material impact on reducing both speeding events and also the average traffic speed, and this has a knock-on effect in terms of a reduction in casualties on our roads. There's lots of modelling, lots of sort of insurance data that's been used in the past to sort of show that there's up to a 12% reduction in injury accidents with vehicles that are fitted with ISA systems. So ISA is a very effective system. TRL for the last, I guess, about 10 years, we've been supporting the European Commission with developing the impact assessments for ISA, along with 16 other vehicle safety measures through the General Safety Regulation. We've also helped with drafting the secondary legislation for ISA systems as well. At the moment, there's still several questions remaining as to whether the UK will adopt ISA systems in the future. And yet we don't have any steer to whether that is the case yet, but within the European Union, ISA systems have had to be fitted to new vehicles since 2022. So the European market has mandatory fitment requirements for ISA systems. With regards to attitudes, there's some very interesting research that's been performed in the last few years, particularly from colleagues at University of Sheffield and University of Greenwich, looking at themes in the beliefs and attitudes of ISA and non-ISA users. And actually, contrary to your belief, Paul, acceptability was generally high for ISA systems, with the caveat that that is as long as the drivers felt they had a choice about switching off or overriding the systems. And actually, the secondary type approval regulations for ISA systems permit this. So generally, for ISA systems, the UNECE regulations, that is, not for UK ones. So generally, the levels of acceptability are high. However, they could be increased further, and that's the findings from that research say that that's due the need for better information for the drivers about the ISA systems, particularly for non-ISA drivers. Particularly that they can stay in control of it by being able to switch off the ISA systems or override it, because that's not often known by non-ISA drivers. They feel like it's something being imposed on them, being there to control the way that they drive. So better information, particularly for non-ISA drivers, would improve acceptance, and also better information around emphasizing the personal benefits of ISA. So the benefits in terms of reducing the likelihood of speeding fines, improving insurance premiums, better fuel efficiency, as I said earlier, as well as the safety benefits would also be really beneficial to improving acceptance. But yeah, generally acceptability was high.
That's good news. And what I've actually just scribbled down to quote a former Prime Minister of ours is education, 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 because it does seem that that's been a theme that's been running through, is actually getting people who drive all the time to understand why these things are actually good for them. Shaun, as chief scientist at TRL, I want to pick up on some of the other technology that we might be able to use in this space. I'm thinking specifically about, telematics. I think of when my daughter was learning to drive and having the black box in her car, but there's telematics all over professional fleets, and Nick was talking about Operation Ping. I mean, what can we do with this sort of technology to actually help make our roads safer through less speeding?
Okay, so sorry, I've been going rogue and answering questions in the Q&A already. I didn't mean to do that. I pressed the wrong button. I'm struck by the clarity of some of the questions, and one just really struck me, and it pertains to the answer I'm going to give to this question. Somebody just asked, what the automotive manufacturers are doing, because one of the enablers of high speeds is high-speed vehicles. I.e. vehicles that can go faster than the speed limit. And I think it's, if I may just go off on a bit of a tangent, I think it's faintly ridiculous that I'm now going to answer a question about a technology, vehicle telematic systems, that can be used to undo something that is designed into the system in the first place. Nonetheless, I will answer the question. The telematic systems, i.e. black boxes in the vehicle or apps on mobile phones, we think have great promise in changing the way in which people drive. Now, the way in which they work probably has to be slightly different depending on the audience you're aiming at. But in general terms, you can think of it like this. If you are gathering good quality data from that system and you are using it effectively in some kind of performance management system, you will get some change in the way people think about and act on that behavior. So with young drivers, for example, we know that a very important thing is that if you're measuring data about speeding or acceleration or deceleration, whatever it is you're measuring, you need to make sure that there's a discussion about that data with some kind of guardian, normally a parent, for example. Within fleets, I mean, TRL work with fleets all the time on this kind of thing. It gets a little bit harder because very often you just have a system sold into a business and they're collecting data, but they're not doing anything with it. And sometimes it's even worse than that. We just completed some work with UCL, looking at telematics and its use in home delivery. And one of the problems there is that the telematics are being used to track data on speeding, for example. So they're being used to manage people's behavior around that particular behavior, but they're also being used to track performance on how many parcels you're delivering and in what time frame. So we have drivers, in interviews telling us, the telematic system tells me I can't speed, so now I have to make progress to meet my targets in other ways. So I might run a red light. Okay, so it's not just painting a picture of here is this technology that's going to solve everything. It's how are we going to use that technology for the audience involved. So yeah, it's a really, really tough problem, but I'll end there.
Shaun, it's an interesting way you're looking at being a panelist on the webinar, and I'm going to suggest our other panelists before. Well, I'm going to ask another question first, but have a quick scoot through the Q&A questions. If there's one you want to pick up and talk about, let me know, and we'll do it that way rather than me randomly picking out things, and I might miss out on an absolutely killer point. But I want to go back to you, Dr. Phil Hyde. As I say, you at the sort of human side of this. Shaun's just been talking about data and information that we have about road crashes. Are we learning lessons from every road crash, and are we actually able to collect the information to create a comprehensive picture of each collision and actually therefore make coping with them in the future or avoiding them easier to do?
Not as well as we could do is the answer. And then and what's the solution? Well, I think collaboration and intelligent use of technology. Interestingly, I mean, we already know that there's been a very effective reduction in road traffic collisions up to about a decade ago, and it was significantly, driven by the colleagues on this call and indeed partaking in the teleconference across the country, and driven through Stats 19 and Crash with a data set that wielded the available data. And we also know there are some limitations to that data set, not least that we don't know the ongoing implications of the collision for the humans involved and broader society. And so we've not yet been able to cost, both in a human sense and in a financial sense, the truth of how much these collisions, which are causing 28,000 serious injuries and 1,500 deaths per year, we don't know what, we haven't been able to describe that really pithily and particularly financially, because we don't know the end-to-end data. So I think that through collaboration, we could link up the police data, other data sets such as TRL Road data sets, the coroner's data for people who die, and the ongoing trauma systems within the NHS and the rehabilitation systems data sets. We could do that. And indeed, the logo behind me, Prana, Pre-Hospital Research and Audit Network, is attempting to achieve that through Southampton University and the NHS and support from NHS England, and in collaboration with TRL. We're trying to link up the data into a single view of collisions, and in order to achieve the point of actually being able to describe what's truly going on, but the other repercussions and benefits of linking the data are huge to the whole of the safe system. And so to answer your question, we could be better. How could we be better? I think by collaborating more, linking up data, enabling the data that already exists to advocate for society and for patients, in my perspective, people more generally. And I think that's on the horizon, but we haven't achieved it yet. And putting resource behind that kind of innovation, I think, would be a useful way to move this domain forward.
Great stuff. Thank you very much indeed. Right, let's move on to some questions, and I'll let the panelists actually pick out some that they want to answer, but I want to just kick off with one which was mention of speed awareness courses. And James Searle has said that they come after the offence and therefore too late, like trying to give up smoking after you've got lung cancer. I mean, has there ever been an attempt to get some sort of primetime TV show, for example, that explains what you see at a speed awareness course? And hands up, I did one about 12 years ago, I think, and it did affect the way I drive. And I was doing 35 in a 30, I think was my offence at the time. But I turned up, was fairly cynical, came out completely different driver because I'd seen the reasoning and the reasons for doing it. It comes back to the old education thing. But have we ever tried, as National Highways, for instance, Nick, ever tried to actually reach the public earlier rather than through the enforced courses?
On the analogy, I think it's more like ideally someone doesn't start smoking, but if they've started, the speed awareness course or the smoking awareness course would help prevent them from taking up smoking again after the course. That's the point. It prevents, you're more likely to less likely to reoffend having taken the speed awareness course. So that's the point of doing them, and why they're more effective than fines. But ideally, here you would want to prevent the offence in the first place, of course. In terms of actually delivering something beforehand, I mean, there are all sorts of road safety campaigns with mixed effectiveness, and Shaun's probably as well placed as anyone to talk about the effectiveness of such campaigns. Certainly the ones that have focused on, you know, the severity of impacts often don't have the expected improvements. You don't see the expected improvements that you would like to have achieved with them. But yeah, I certainly think there's more we could do to encourage the right behaviours, put it that way.
If I can just come in there, and just to add to what Nick said, I mean, he's right that the sort of broad history of road safety campaigning, educational approaches, you know, I'm not saying we don't need it, we do, but it's modestly effective at best. Often it can be completely ineffective. And actually, you know, Paul, the only thing you've said in this session that I've disagreed with is the whole education thing. It's absolutely the least important part, in my opinion, of getting a direct impact on collisions. It is necessary to support all the other components and to sort of change culture over time. But honestly, what we need is automatically, you know, is safety built into the system from the outset. Very, very strong enforcement and compliance, ideally as well, and then underpinning that a sort of culture of acceptance that we all should be behaving in a better way.
Okay. Anyone else want to pick up on any of the points? Yep, certainly. Carry on then, please, Phil.
Thank you, Paul. Yeah, Shaun, really good point. And I think ISA systems can be a key enabler of that. And not just that, we know that work-related road safety and people travelling for work also account for a large proportion of the collisions we see on our roads. Some studies put it at 20% or more. So if we are to look at all the levers that we have available to us, good communication, good education, vehicle technology systems, road infrastructure, we've got good safety management systems within these fleet operators potentially. Maybe that's a really good mechanism, bringing all those levers together with ISA as an enabler, helping those fleet operators understand the benefits of adopting such technology and therefore using that technology as it's supposed to be, as it's intended to be used to effectively reduce their speeds on the roads, improve safety outcomes, improve fuel efficiency, improve all those other benefits, and the amount of miles that they get through on the roads relative to other users of the roads would also help manage the flow of some of the traffic around them as well. But, you know, there's a really good opportunity there. We know they're an important part of the fleet, the mix of vehicles on our road, and we know they're an important part of those road casualty statistics too.
Okay, Nancy, I just want to pick up on one question that's come in on the Q&A from Rizor Rahman, who's looking internationally and wants some advice on the most cost-effective methods or approaches for lower-income countries to be able to reduce their speed on their highways.
Actually, just what Shaun and Phil and Reid were talking about is also very particular to low and middle income countries. I think I share the opinion that a lot of times you see campaigns are easy to run with, but then it's also very difficult to measure, you see, and also the fact that it's a very diverse community. The knowledge awareness that Shaun has is very different from what I have, is different from Phil has. So if you do it for 6 months, what kind of reduction do you have? I think measuring the impact of it, while it's easy to run with, but then most of the time, even in low and middle income countries, they tend not to be very effective for that. But generally, Paul, what you're asking me, yes, there's actually a good data, you see, that has been published on what works and what doesn't work in LMIC. This was following a lot of research by GRSF. So there's actually a document, a book of, you know, listing all the measures that are being taken by agencies, by authorities, and detailing why it works and why it doesn't work. But one of the key things that maybe I want to say is infrastructural changes. You see, enhancing the quality of infrastructure is one of the key things that works for LMICs, you see. And education, while it can enhance awareness and everything else, over and over again, research has shown that sometimes it does not deliver the kind of, outcomes that we want. And similar to enforcement, well, enforcement, you see, is seen as, you see, a very key thing to do in certain areas. It's more or less like the carrot and stick. You see, I put enforcement today, over 1 month, speeds have come low, you see. And then I remove enforcement, and somehow we have this spike. But so for LMICs, what is critical is, one, to review the kind of traffic mix that people have, you see, in that area. And then from that, define what works. You see, what is our current situation, what is our, but lastly, Paul, to say this, that other than implementing some of these interventions, I think one of the key things we need to do is to make them evidence-led, find a way of finding data that supports the intervention you want to implement, and then implement it over a period of time. Also, the whole thing of, you see, it's a short period and then you fall back. You see, it becomes very difficult to measure. We measure it, and then after that we say, this work, this doesn't work in this place. But also, other than that, I can't list all, but to the person who's asked, I can actually put the link to the document. You'll provide quite comprehensive information on that.
Fabulous, thank you. And in fact, what we'll do is we'll keep all these questions, pick out some more, and our panelists can actually put some posts on LinkedIn, and you can continue the conversation on LinkedIn with them on this to talk more about it. Nancy, I'm going to go to you first, and we're going to go around our panelists just to wrap up, because we're just about out of time. I just want one line on your priority. What is the one key thing you would do to change attitudes towards speed?
The first thing I would do to change attitudes towards speed, is allow me to talk for LMIC's countries, you see, is, I think one of the first thing is remove the hierarchy that car ownership has in LMICs. This, I think, is one of the single most powerful tool that can reduce this vehicular pedestrian conflict on the road. You see, when we demystify car ownership, find a way of enhancing public transport, alternative transports other than private car, I think it's one of the single most thing we can do for LMICs. Thank you.
Okay, thank you. Let's stick with TRL and go next to Phil Martin.
Yeah, thanks, Paul. Yeah, I guess from a lot of what I've said today, I think I would go, my priority is around communication. So, and I say that mainly because not only we've got a lot of mechanisms to be able to change the speeds that people drive on roads, or to make roadsides more forgiving. However, people don't understand why. Why are we asking them to drive at 20 miles an hour, not 30 miles an hour in an urban area? Until now, the message has been because it's safer. And yes, 50% of people are listening to that message, but there's another 50% that aren't listening to that message. And we need to appeal to other drivers and other motivations than just safety, to achieve the goal that we're all trying to do as road safety professionals, which is get people to stick to the speed limits that have been, determined through evidence-based approaches. And that's to do with getting that buy-in from the public, getting that buy-in from drivers on our road. So communication is my priority, and finding different channels to communicate.
Shaun?
Mandatory ISA on all vehicles, because your behaviour drives your attitudes more than your attitudes drive your behaviour. That's what the evidence generally tells us. So that would be the thing, because it would get people into the habit and they wouldn't have any choice.
Fabulous. Nick?
I think a sense of frailty. I mean, I want as few people as possible in the nicest possible way, Phil. I want as few people as possible to meet you.
Yeah.
And people being aware of both their own frailty within a vehicle, but also the frailty of those around them when you're driving a vehicle, other road users, pedestrians, cyclists, horse riders. Making sure that we minimize those injuries as far as possible.
Reminds me of a comment I heard once that was, well, there were two. One was people who don't cycle drive like idiots past cyclists, and the other was that people drive like idiots because they've never been killed in a car crash, which I thought was a particularly pithy point. Let's finish our webinar by hearing from Dr. Phil Hyde, paediatric intensive care consultant who has to deal every working day with the effects of speeding. Phil, what would you change? What would be your number one priority?
Yeah, thanks. And I'd add to your last point that they haven't been killed in a road traffic collision, and nor has their child or their wife or their brother or their sister or their mother. I agree with Shaun, and I would want to change speed from being a political and civil liberty issue and make it a public health intervention. And so mandatory ISA, I'm with Shaun.
Terrific stuff. We could have talked for hours, but we've managed to keep it to the hour. I really appreciate well over 100 people who joined us for this webinar, which has been recorded, so you can very soon be able to view it on the TRL website and share it with your colleagues. And I think there's an awful lot to take from the last hour we've had. Thank you for watching, and I will finish by just thanking our panelists, Dr. Nick Reed, founder of Reed Mobility and Chief Scientific Advisor for National Highways, Dr. Phil Hyde, Paediatric Intensive Care Consultant at the University Hospital of Southampton, Dr. Shaun Helman, Chief Scientist at TRL, TRL's Head of Transport Safety, Dr. Phil Martin, and Nancy Abira, Safety Consultant at TRL. Thank you for watching, and we'll have another one of these webinars from TRL very soon. All the best and enjoy the rest of your day. And if you're in the US, happy Thanksgiving.